Great, welcome everyone to another special health focus Tai Chi and Qigong class. Just before we started the class, I asked everyone if there was anything that they wanted to cover, and something came up. What about swelling? So swelling in an ankle, but it could be any part of the body. And if there is swelling, I would pretty much straight away associate that with edema, which is another word for swelling. It means that there's fluid in the area, and this is perfectly normal. It's the body's response. If there is a wee issue in an area, that means that there's increased blood flow, so that the body can bring nutrients and white blood cells to fight infection or whatever it needs to bring to the area. But often the sort of collateral damage of that is that there's excess fluid that gets stuck and hangs around. Just letting somebody else in here. So, but do not despair if you do experience fluid. First of all, if it's unusual, yeah, you might want to check in with your doctor or even talk to a pharmacist. Sometimes it might be something, unforeseen, like an insect bite or an allergic reaction. So there's more than one reason for swelling. But what I would generally do is a little bit of lymph work, and that can help greatly in the reduction of edema. The other thing to think about is your fluid balance correct? So if you have edema, it may be that you're getting plenty of fluid but not enough electrolytes. So if that is the case, the body has to work very hard to make sure that it has the right chemical composition, it has the right salt, sugar, electrolyte balance. And so often doctors will give people salt tablets if they have edema. And it's just a little bit of salt which aids the absorption of fluid, and then the body can naturally find its levels. But again, that would be something you would talk to the doctor about, or you could talk to your chemist about. But what I'm going to show you is just a few wee things that you can do to aid the edema to absorb back down. So often it can be from tight clothing. So say for example the elastic band. Here I have a sock ready, an elastic band at the top of your socks, and that can act almost like a tourniquet, that the fluid just can't make it past that slight tightness. So it doesn't have to be something that is, giving a choke hold to your body. It can be just a slight pinch, and then the superficial lymph is struggling to get beyond that. So you'll know that you're experiencing that if you take your socks off at the end of the day and you have a ridge in your leg. So you have that dip in the flesh of your leg. That is typical example of lymphedema, that there's just that little bit of swelling because there's been constriction. So quite literally, I go around chopping the elastic bands off the top of my socks, and if you chop all the way around, they tend not to unravel. It's only if one section is torn that they'll start to get ladders. So that's my way of dealing with it. You can get honeycomb top socks, special socks to address edema, but actually I find them really quite restrictive as well. So I have a regime. If I buy them, I stretch the living daylights out of them. I actually wrap them round a sculpture that I have that's about the thickness of an ankle, so that I'm just loosening the weave of that supposedly more gentle honeycomb. But think about, what lines do you have on your body when you take your clothes off? So it's often underwear that might seem comfortable or might seem perfectly innocent, can actually be main culprits. So ladies, across the shoulders, underneath the bust line, and also the triangle of underwear down beneath. If it's cutting into your leg even a little bit, it could be causing substantial edema. So if the swelling is in your ankles, maybe the issue is your underpants that you're wearing. It might not be anywhere near your ankles that there's a little bit of restriction, but that can then cause a knock-on effect which leaves the legs heavy. So there are things you can do. We're going to salute. I'm going to start close to the screen. Right hand in fist, left hand straight together, and we press forwards. Good. So let's rub our hands together. This is a general energizing practice. It has the effect of exciting your energy, rather like if you see children rubbing their hands together and saying goody, goody, goody. It just gives the energy a little bit of a boost. So then we're going to go to the chest and we're going to rub across the breastbone, or rather rub the flesh across the breastbone. You don't have to be very hard, just gently does it, but we're just moving the flesh. This is the main drain for all of your lymphatic system, so the entire body drains into the chest. So if this area is bunged up, again, that can affect the entire system. So what I would say to you is, on your days off, sorry folks, make sure you're careful who's listening, but just take your underwear off. Just wear loose, comfortable clothing. You can wear loose, comfortable underwear. You can wear men's boxer shorts if you like. I quite like to do that because they're much freer and less restrictive. So do consider that, please, because it can make the world of difference. So we rub again, and we're going to go to the collarbone. We take the hand onto the collarbone. You can cup the elbow with the opposite hand, and again just gently maneuver. So regardless of where the edema is, say it's in your ankles, I would still do this. Work on your chest, work on your collarbones, because everything drains here. And one side of your body, almost all of your body, drains into one side, and the other side is just responsible for half of your head and one arm. But it's good to just work on both sides. Yeah. So we rub, we take hold, and we gently mobilize. So by the way, this will aid with general well-being. It will help if you're feeling sluggish, if you're feeling yucky, if you've got a bit of a bug. Doing lymph work will help your immune system immensely, though it may make you very tired. So be aware of that and rest as necessary. And if you have a long day ahead of you, as I'm talking, just go sparingly on this, and you can do it again at the end of the day so that you can have a drink of water and go to bed. Okay, so we're just going to stroke down the throat. Good. You see I'm going from the back of the ear down to the chest. Slow, soft, rhythmical movements is the key for manual lymph drainage. So we're acting as the pump to move the fluid along. And I would only do one side at a time in the next one, where we do a little pitter-patter, just gently wiggling the fingers, and just go from the back of the ear down the neck. And the other side, pitter-patter. Good. Now, if you have sinus issues going on like I do, there's a whole range of lymph moves for your face. We're not going to do all of those today because we're going to do some silk railing, but we'll just cover some general moves. So we start at the chin and we go up the front and center and down around the outside, and we can do that 3 times. And even this little bit of gentle massage can really help to shift the lymph. Now we do the same thing, but this time we actually go over the head and down the neck again. So again, I was playing around before we started with the Zoom filters. You can put makeup on by clicking a button. That's the only way I'll ever wear makeup. Very good. Okay, so we rub again. So we'll do a little bit for the arms. So very, very useful to reduce the risk of breast cancer. Excuse me a second. So you can tell that lymph work is working because my nose is running. So gently massaging the chest area every day is very useful for just helping everything to clear, helping the lymph to flow, helping the blood to flow, helping reduce the risk of stagnation, which could then turn yucky. So we're going to lift one arm and we're going to come underneath the armpit, adhere to the flesh and gently pull towards your hip. Let go, lift your arm a wee bit higher and go to the mid armpit, and this time we stretch the flesh towards the opposite breast. And then we lift the arm again if you can and go to the very top, the top of the armpit, and pull towards the opposite shoulder. So you can do any combination of that, it doesn't really matter. We're just mobilizing and shifting. And you can do a little with a hollow fist or cupped hand. You can just pat the area all the way around, and we can pat over the collarbone as well, just to give an extra bit of encouragement. Good, and again on the other side, so we start quite low at the bottom of the armpit, take hold and press down towards the opposite hip. So can you see I'm just kind of curling my hand into a light fist and pulling down. Then I lift my arm a little bit more, I come to the mid armpit, so I'm actually on the chest beside the armpit, and I stretch towards the opposite breast, and then I pull up the arm to give it a bit more stretch, or you could reach up. You want to feel a stretching top of the armpit and pull towards the opposite shoulder. Good, and then again you can give everything a little bit of a thump, or you can cup the hand and pat around. Good, so if there's edema in the wrists, at the elbow, this will help. Okay, so now we're going to do the core of the body. About 70% or slightly more of your lymphatic system is going on in the digestive tract. So when we help the digestion, everything to move nicely, we are helping all that lymph process. So let's get, if you find your rib cage, please. I know some of us have to really play around, but you'll find your rib cage, and I just want you to stretch along the line of the rib cage so you can stick to the ribs and pull out along the line of the ribs. You can do it left and right a few times. That helps to release and open the diaphragm, which helps you breathe. And again, breath really helps the lymph flow because it pumps your lymph. Every time you breathe, you take a pump. You pump your lymph. Okay, so we're going to get the fists into the guts and move around. So do you see I'm not moving my arms because that's exhausting. I'm turning my belly, and because I'm turning my belly, that moves my arms, and then that's stretching the flesh a little bit. Let's change hand positions. I don't mind where you go, just keep changing, keep shifting, get a little bit of stretch there in across your entire lower abdomen basically. Good, and just give everything a bit of a stretch. Good, okay. So we can lift one arm and pat down from rib cage to hips, and the other side, rib cage to hips. Or you can just have a free-for-all drum roll. So let's give it a go. And it's quite tiring. All lymph work is a little bit tiring, I find. Whew. You feel like you have worked. Now, do you remember we were talking about underwear slightly cutting into the flesh, and that can in turn reduce the lymph flow? It's amazing how a little thread of elastic can actually majorly cause lymphedema. So we're going to go into that crease of the leg where elastic often sits, and we're going to, you can do this seated, by the way, if it's more comfortable. Just sit down a little bit, even if you're standing, get into the crease, press into it and pull up. Press in and pull up. Now you could try going a little bit deeper in your stance each time, but don't force it if that's difficult. Onto the other side, we get into the crease, pull up, we can go a little bit deeper, pull up, a little bit deeper, pull up. Good, well done, up you come. And now this time we use the blade of the hand, so it's like a chopping action, nice and loose. be careful, gentlemen in particular, you don't want to hit anything vulnerable there. So you find the crease of your legs to body, and we do 3 chops. 1, 2, 3. Now, if you have a lot of edema in your legs, you can do a lot, and you could use cupped hands if you like. You can just cup that whole area, but actually 3 is enough for just a moderate bit of stimulation for the lymph. The more you do, the merrier. I have seen some Qigong masters saying you do 60 times or 30 times. To me, that's quite a lot. But you can build it up to that. It will definitely help, but sometimes less is more. So if you're feeling really quite sluggish, doing a little bit regularly rather than bombarding your system a lot at a time will be very useful. Now, the rest of the legs, you can do this stroking action. Do you see what I'm doing? I'm stroking upwards, and I'm starting at the top of the leg with a little kind of paddle action and going down, and you can do that at all different angles. Now, you can buy all sorts of little tools to help you do this, and some of them are great. I have 1 or 2 here, but actually your hands are fine. You know, you don't have to be buying skin polishing brushes and all that stuff. Just using your hands, you can go a long way. So you're just paddling, as I say. It's not pressing, you're not pushing, just very, very gently stroking upwards. And you see, I'm starting at the top, I'm moving downwards, but I'm stroking upwards. And you can continue that all the way down. In fact, I have a couple of the wee tools. I'll show you here. Excuse me while I climb out of screen. Okay, so here are just 2 small little tools that you can use. So this one is a wooden handle with 2 little roller balls, and the roller balls have ridges. I'm not sure if you can see that. I think you can. Yes, the wee ridges. So very, very useful. It's a small wee tool, and yet it can do a great deal of good. So you would just gently roll upwards in the same way as we were paddling. You can roll upwards. You would never roll downwards. You're not putting equal pressure on the upwards and downwards. You're rolling up and then releasing. So you can get something like this. That's very, you know, very modest, that the likes of TK Maxx we would have here. They'd have little massage tools, things like that. So very, very useful. Actually, out of all of my tools, because I have loads of lymph tools, and some of them are big and fancy and a bit scary looking, whereas actually I find this one is one of the best. It's, you know, I can put as much pressure as I like. I can really focus on where I'm pushing the fluid, and again, I'm starting at the top and working my way down. So very useful. I would highly recommend. But as I say, you don't need any tools. You can just use your hands. Here's another one. This is a wee rose quartz roller ball. I think they're designed for, you know, the more sort of facial beauty regime, but it's really nice, and just as, you know, just as good, that you can just get in there and roll away. And you can be very creative, like this we do for Dinkle here. This is designed for taking loose hair off of dogs. You can see that. It's a sort of soft, squidgy, triangular, it has these triangular dimples, but it's really actually quite nice because it has a similar effect to the skin polishing brush. It's gently mobilizing, encouraging circulation of the blood, but it's also helping the lymph to drain. So you could use something like that. So I mean, you know, there's lots and lots of equipment out there, but actually you can be very creative. Even just your scrubbing brush in the shower, perfect. Just circular motions, excuse me, sorry, and start at the top and work your way down, always brushing upwards. But one last thing, let's think about this. So for ankles, for feet, for wrists, for arms, actually wherever the edema is, one of the best things you can do, and I do it most nights, I must say now, is lie on your back in bed and put your arms and your legs in the air and wiggle your fingers, wiggle your toes, have a wee shake out. It looks like this. I'll show you. You don't have to do it with me now, but this is your homework tonight when you lie in bed. Make yourself comfortable, make sure it is comfortable. If you can, or even just holding your arms and legs, it has quite a nice meditative sensation. It feels a bit strange, but that strange sensation is gravity and your lymph draining. So if you can hold your arms and legs up for 20 seconds, you're getting a really good lymphatic drain because gravity is doing the work for you. But adding wiggling fingers and wiggling toes just aids the pumping action of the lymph and will help things drain a lot quicker. However, if you are still wearing your tight underwear underneath your sleepwear, it will still be restricted. So I would definitely say look to what underwear you are wearing and choose things that are very loose indeed. Or, as I say, if you're in the comfort of your own home, go without underwear. It won't do you any harm at all. It will give the lymph every chance to drain thoroughly. So there you go. I hope you enjoyed that. Sorry for being so graphic, but these things make a huge difference. So as I say, make sure that your fluids levels are correct, that you are getting your isotonic balance right. So it's not enough that you drink lots of fluids if you're not having a little bit of salt, a little bit of natural sugar, if you're not getting your minerals, that could be an issue. So I would recommend a little pinch, tiny pinch of sea salt or Celtic salt before each drink. Just like a couple of flakes of salt, that's all you need. But avoid table salt because it has anti-caking agents that are the things that are going to be less than good for you. Okay folks, so unless there's any questions, and do jump in if you have any questions, we're going to do now some silk reeling. So up you get please. I'm just going to finish all that by rubbing your hands and taking your hands to your kidneys. Bend your knees a little bit and give your back a jolly good rub. Now even if you don't do the rest of the lymphatic work, I would like you please to rub your kidneys every day and make sure you keep them warm. Keep your bottom warm as well, and hold your hands to your kidneys and feel the warmth flowing into your back, and breathe. Good. So the urinary system is part of the lymphatic system. You get rid of waste through both pee and poo and sweat, and even you're breathing out some waste products. So even sometimes doctors and dentists will identify that there is an issue, a health issue with someone by the smell of their breath. So we are sweating out toxins and yuck. I'm trying to think of waste. We sweat out waste, we pee out waste, we poo out waste, we breathe out waste. Basically think of everything we excrete, the body uses as an opportunity to get rid of yuck from our bodies. So if you have been exercising and sweating, dry off the sweat straight away, not with your hand but with a cloth, because you can actually reabsorb the yuck if you touch it, if you touch the sweat. So have a shower and dry yourself off. It's very, very useful. Actually, sweat helps us to get rid of quite a lot of toxins as well. But because the urinary tract is part, or the urinary system is part of the lymphatic system, we want to look after those kidneys, especially if you're having a bit of swelling going on, edema. It could be a little indication that we need to take more care of the kidneys. So rub them every day, keep them warm, and do Tai Chi. Okay, so let us have a look, please, at stepping backwards. Now, stepping backwards, I often associate with kidney health. So we're going to come forwards in order to go backwards. And excuse me a second. Okay. So before we actually start the stepping back, let's look at the arm movements for the silk railing. We will bring the feet together and lengthen up through the top of the head. Bring the chin slightly down and back. You can see there's a light fitting just above my head, but that's perfect. It looks like I'm a puppet on a string, and we want to really lengthen, not with force, but gently float up at that topmost point of the head. Bringing the chin slightly down and back, and release and relax, just like that puppet on a string. Let the body release from the topmost point. Now, with your feet together, you may feel a little wobble. Don't panic if you're wobbling, but you can rest the tip of your tongue up against your top teeth, on your top palate. Think of going to say the word no. Place your tongue where you would begin to say that word, and if you rest your tongue there, you may notice that actually your balance improves. But just relax your tongue in that position. Okay, we're going to release belly, hips, knees, and step out to your left. I'm going to go to my left. There we go. All right, now we're going to extend one arm forwards and release belly, hips, knees, relax the arm down. I'm seeing that my internet connection is unstable. Sorry about that, hopefully it's okay. We're going to take the other hand to about level with the dantian, so that's about 4 finger widths beneath the belly button. Turn the front palm to face up and the other hand to face down, and it is still in front of the body. Do you see that? I'm not here, I'm here. So my very first Tai Chi teacher used to call it armchair position. It looks like you're sitting in an armchair. We're going to turn the waist very gently, and that turns the palms. And we just let them drift across quite naturally, and then at the end, twist, draw in. So the front palm facing up, and the back palm, for want of a better word, pressing out. But it's not, it's not back, it's out. Do you see that? There's a full rotation of the thumb turns in, the little finger edge is somewhat pointing in. Release from that position and very gently turn the body, and we do the same on the other side. At the end we twist in, front palm facing up and the other palm turned a little bit in. Now I describe that often, you know those egg chairs from the 1960s that you'd sit in and you'd kind of push your hands into the curve of the egg? That's the feeling. That's the best way I can describe it. Hopefully that makes some sense. Good. Release, turn, and rotate. Both arms are rotating fully. One is fully turned up, the other is fully turned out. Release, turn, and rotate. Release, turn, and rotate the arms. Release. Good. Now I'm going to show you it from the side. Release, and both hands twist. Release, and twist. Release and twist. Release and twist. Now, when you watch this video, you can turn me off, turn the sound off, and just see if you can follow the movement silently and feel the release as you turn the body, the arms untwist, and then the arms twist at the end of the movement. Yeah? Good, and rest. Well done. This is quite subtle. Let me show you the movement when we're stepping back, combining that with the leg movement. Now, over the years I've noticed that what seems apparently very easy and is subtle is far more difficult to actually integrate and fully understand than the more obvious big movements. So if you don't get this straight away, don't worry. Just watch first and then we'll do it together. Okay, so I'm going to start with my feet together, lengthening up and relaxing down. And just letting go for a moment of tension. I'm going to extend my right arm and releasing belly, hips, knees. I'm releasing shoulder, elbow and hand. And as I go into the palm position, I'm lifting my right heel. So the hand that's forwards, that's the foot the heel lifts. That's the foot that's about to step. And if you watch me please, I open, so I'm not stepping directly back, I'm stepping a little open, but I'm keeping the feet parallel, so I push the heel out a little as I feed the weight back, and then as I pull the foot in, my arms twist into that yin-yang twist. I release the arms as I go to step, feeding the weight back, letting everything drift to the other side, and twist. Release and repeat. Push the heel out so that you're parallel, and in, step, and in. Okay, so let's try it together. Wondering, would you like to see it sideways before we do? No? No? Let's try it together. Okay, so I'm going to actually do it with my back to you, so I want you to start at the front of your space and we will all step backwards together. So we're doing exactly the same thing together, please. Ready? Feet together, we lengthen up, chin slightly down and back, and relax your body down. Calming down. Let's extend. We'll extend the left arm first. Release belly, hips, knees. Relax the arm down. Lift the left heel, the right palm onto the armchair. And touch. Push the heel out as you feed the foot down. Then feed the weight back. Arms twist as you release the foot. Release the arms as you step, touch, heel pushes out, foot down, weight back, and twist. Release, touch, heel out, foot down, feed the weight back, and twist. Touch, push the heel out, feed the weight back, and twist the arms. Release, touch, heel down, weight back, and in. Well done. Rest. Relax back down into the earth. We heel tap. Excellent. Well done. Now I'm not sure if you're feeling it yet, but it is a very deeply relaxing wee practice. I love it. And because of that, I feel it is very much a kidney bladder exercise. Anything that chills you out and sort of takes away a sort of fear response is a kidney bladder move. Excuse me a wee sec. So let's do it again. Now the idea with it, if you're going, I don't feel that yet, I feel a bit edgy, I'm walking backwards, my balance isn't great, that's fine too. If you know your balance isn't great, you can do this next to a wall, sideways onto a wall. So at any stage you can just put your hand out to balance yourself, to give yourself a wee bit of comfort. But you'll notice we're never throwing our weight back. In normal walking, we throw our feet forwards, we throw our weight forwards, and that's how we walk. But in Tai Chi, you never throw your weight. You always step first. So you check the ground with your foot. Is it safe? Feels safe? Then you relax the foot down. Check again. Does it feel stable? Is it, safe? Or is it slippy? Is it ice? If it feels okay, only then do you shift your weight back. And at any stage you can stop, you can reassess, you can go forwards again. So in that way it is very safe. You are in control at all times, and we go slowly so that you really have blow by blow, moment to moment experience, and if at any stage it doesn't feel right, you can stop. Whereas if you just throw yourself back quickly, you've no control. So let's try it again. I'll stop talking. Let's see if we can do it comfortably. Ready? This time, right arm. So we lengthen up. Calming down. Listen behind you. Extend your right arm forwards. Release belly, hips, knees. Right palm faces up, left palm faces down. Right foot releases. Ready? Off we go. And rest. One more time, please. Let's go forwards. Lengthen up. Relax down. Left arm extends. Release belly, hips, knees. Right palm faces down. And rest. Well done. Heel tap. Last time, please. Let's come forwards. Lengthen up. Relax down. Extend right. Sit down. And down and a little heel tap. Beautiful. Well done. Okay, so common issues wobbling. You may be taking too big a step if you're wobbling a lot, so you can slightly reduce the size of your stance if you need to. Calming down is very important to help you balance. So if you're worried about falling, you're probably up here where you need to be down here. So keep calm and keep breathing, which will feed your muscles and feed your brain and aid the whole the whole practice. It'll help your center of gravity to stay nice and low so that you feel grounded and safe. Whereas when we freak out a bit, oh, I'm going to fall, energy rises, shoulders rise, everything goes up. That's less good. Also remember to just gently keep your tongue up behind your top teeth. Now, from the get-go, when I studied Tai Chi, actually after the first year, the master I was practicing with, every class he would say top of the head up, tip of the tongue up, and he also talked about the pelvic floor muscles being slightly drawn up. And for years I studied with the Chen masters and they never mentioned that once. They talked about the top of the head and that was it. And I asked Master Chen over a pint one night. I don't drink, but we were in the pub, and a pint of water, and I was saying, why don't you talk about that? You know, that my teacher talks about that. And he says, oh, who told you to do that? Don't do that. So certainly the pelvic floor muscle business, you don't need to do. It actually does itself. If you do your Chen style, so you're lengthening up and you're relaxing down, everything relaxing from that top point, your internal muscles, they all engage quite naturally, very gently without you even realizing it. So your internal structures are tonifying. You don't need to be doing like the Pilates, talk about zipping up, pulling up. I had one teacher in ballet who did Pilates, and he talked about, imagine that someone has stuck a red hot poker up your backside. I'm like, I'd rather not. Thank you very much. But luckily with Tai Chi we don't need to do any of that, as long as we maintain the topmost point lengthening up and release, relax down everything else. Those muscles, the internal muscles, the pelvic floor muscles, all of that stuff actually does tonify without any thought to it. It's just a side effect of the practice. Excuse me while I blow my nose. Okay. So relaxation is important. We need to relax in order to stay grounded and feel secure and stable. Another common issue for people is that when they put their foot down, they tend to relax their heel in. And this is the most natural thing in the world. If you put your foot down, the heel will roll in. But if you do that, you'll end up like this. So anyone who has studied Yang style with me or anyone else will know that normally in stepping back you do actually turn your heel in, and then the front foot needs to be adjusted, and then you do it again, you turn your heel in and the front foot is adjusted. Chen style, however, is the seed, if you like, from which the tree of Tai Chi has grown, and it tends to be more martial and less forgiving of our human comfort, shall we say. It's a martial art and it's designed to sort of sculpt us, and also to not necessarily just go with what is most convenient for our body. So we say nature is the first principle of Tai Chi. It is, and yet we want to sculpt our nature and not always just go with what's most comfortable. So in Chen style, as I say, when we touch the foot, we touch the toe, we actually think of pushing the heel out as you put your foot down, and that will keep your foot parallel. So you're not actually pushing your heel out, that's extreme, but just that little feeling of pushing the heel out will keep your foot parallel. Feed the weight back, and then you don't need to adjust the front foot because it will also be parallel from the last step. So then you go again, touch, and think of pushing your heel out, feed the weight back, and come in. So that's what we're aiming for, folks. However, if you're struggling with that, maybe your balance just doesn't accommodate for parallel stance, or your body is just screaming at you, maybe you have a swollen ankle or muscle issues, or for whatever reason, if you can't do it, you can't do it. No worries. So if you do find yourself with the heel turning in a little bit, then that means, just like Yang style, you'll need to adjust. Okay, so it's not what we're aiming for, but it may well happen that the heel comes in a little bit. If so, just make sure that front foot does not maintain the open position. Okay, wee dog. Okay, so if you maintain the open position, no harm will come to you from the health perspective, but from a martial perspective, this is an open invitation to have your groin attacked. This is opening the golden target, shall we say. Yes, thank you very much, lovely. Yeah, teaching at home means it's very difficult to say, get out. Sorry, right. So, do not leave your feet in the open position. That is not useful. It's not as stable. So, whether you can do parallel stance or not, just fix your front foot. If you are fixing your front foot, it's fine to turn the toes in a wee bit. It's fine to push the heel out a little bit. Just don't mash your foot on the ground. One or the other is fine. So hopefully that has covered some commonly asked questions. Are there any questions, comments? Yes, Pam? No? Just takes a second to, yeah.
I'm just going to have to practice the parallel because I'm just stuck in yang, you know?
Yeah. It's very normal. It's like an accent, isn't it? It is an accent. So if you have your local accent, something you've grown up with, and then you're asked to pronounce things in a different way, it's difficult. But it does lend itself to giving you neural plasticity. So
Mhm.
if you can work on something that you're not used to doing, it gives you an elastic ability to adapt. And it means if you can balance in parallel, it means that you have stepped up a gear in your practice. It's much easier to balance on one leg with the turned out foot. If you can balance on one leg with parallel foot, you have advanced. But don't worry. If, as I say, if you're struggling with it, it's something to be aware of. You can chip away at it over time.
Right.
Yeah, for a long time I did step back turning the heel in. You know, we were told, well, it's better if you step parallel, but you know, just what I have just said to you, you know, I kind of went, well, I'm turned out, so it's fine, I'll just fix the front foot. And I saw my teacher, who is under the Grandmaster, she's a family student of the Grandmaster, was doing the same. And then at one stage, I think she went to China, she went to Chenjiaogou village, and they kind of, I'm not sure you could say read the riot act, but they basically said, this is how we do it this way. So they were basically telling us, you're being lazy. It's not that you can't do it, it's that you're choosing not to. So there's a difference. If you can't do it because you can't do it, that's fine. Don't worry about it. Just do what you can. If you can do it, but it's just a bit different and a bit awkward, try gently to ease your system into it. You know, so it's not vital. Nothing bad will happen. But you know, if you're going to learn the accent, try and learn it properly. Do you know what I mean? So, but yeah, the grand scheme of things, it won't make any difference. But it's our style. Okay, folks, up you get then, unless there's any other comments. No. Okay, so with only 5 minutes left, where did that go? Let us do it one more time, folks, left and right. And this time I want you to relax and flow. Let your breath flow. And that's a big thing. When we're doing Tai Chi, when we're doing silk reeling like this, now is the time to practice breathing. Even as something is difficult, breathe through it. Because the first thing people tend to do when they're trying to get their system to do something new is to hold our breath. And that's a little stress response, it's normal, but if you can keep breathing, you're going to find it's a lot easier. So let's try. Ready? We lengthen up, chin down and back, relax down. Left arm extends. Release belly, hips, knees, right palm down. Off we go. Soft, gentle. Encourage the heel out. And rest. Well done. One more time on the other side. Of course, if you're struggling with this, say you're just mentally tired, physically tired, you've just had enough, what you could do is sit down and just focus on that beautiful fluid motion in the arms, or you could just keep the arms in a nice structured posture and focus on the legs. So Rome wasn't built in a day. Any attempt, any chipping away is going to benefit. So don't worry about getting it all in one go. Just have a go at something. Ready? We lengthen up. Relax down. Right arm extends. Release the right heel. Sitting down. Off you go. And rest. Very good. Okay, folks. So maybe for grandmasters, maybe for masters, this stuff is very easy. But actually it is designed to challenge us at every level. So I still feel challenged. I'm focusing on getting the etiquette right, doing the technique right. I'm focusing on relaxing and breathing, on making it fluid, on making it seem effortless by relaxing into it and all the rest. But it's not that easy. Even though at some level you might think it's easy to refine and clarify and do your best, it is designed to be a challenge. So please don't despair if you're thinking, oh gosh, this is difficult. This is the path that I've shown you, and now in order to develop ourselves, we walk the path and we garden the path, so it's like you're walking along with your little sharp stick and poking out all the wee weeds as you go and just neatening up the edges. That's the nature of the beast, that we yes, if you just go, oh, isn't this lovely, I'm floating on air, great. But it is designed to both be enjoyable and relaxing and be a challenging way to develop your skill. So please keep practicing this. Just one move in a day practice. You will get a lot further than doing 50 moves in a day and practicing it 5 times. So one little step can really make a difference. We're not going to just do that every week, but we're going to do that a little bit more, and then we're going to start into our form. So you've actually completed silk reeling 1. I think we did double arms and forward stepping, didn't we? Didn't we? Sort of. We'll maybe go over that next week, forwards stepping with double arms. But then we will have completed silk reeling 1. So then I'm going to start you into some form. Okay, so let's finish off with bibbing shell. We're going to drape the wrists, soften the body and bounce. And this is another lymph practice. So after you have done all of your rubbing and patting, you can go straight to this, and that will help to pump the lymph. So any edema will get a good bit of movement and relax down. You only need to do it for a few seconds. The ancient saying goes, 7 heel taps every day, 100 ailments go away. So that's basically, do 7 heel taps and your lymphatic system will get rid of the junk. Good. Stand for a moment, feel the buzz, feel the sensations that your body has worked. And gather up your energy to center, hug your elbows gently in, breathing into your belly. And feel your energy is stronger. Ah, beautiful, well done. Don't forget your homework. Lie in bed with your arms and your legs in the air and give your fingers and toes a wee wiggle, just for a few seconds, and aid your lymphatic drainage. Thank you so much for joining me today, everyone. You've worked really hard. Let's salute. 学生好, and you can say 老师好, and I'll see you next week. And I'll see if I can get rid of the makeup app. It's given me eyebrows. I don't know. I don't like it. But anyway, thank you very much, and see you next time. Okay.
Bye-bye.
Bye.